which are usually performed by nurses itself. All the students, they know that there are a lot of tests that are performed, which are performed to patients in the hospital. So basically, we're going to focus on two things: urine dipstick and blood glucose testing. Okay, for this procedure, for urine dipstick test, normally nurses can do this one in the hospital. Okay, other than the routine urinalysis. This one, nurses, we can do this in the hospital. And as such, nurses needs to learn how to do the test and how to interpret the result. But this is very easy for the students and this is easy for the teachers. So basically, before you collect the specimen from the patient, you ask the patient first to do the usual perineal care because you don't want to contaminate the urine and you do not want to cause false negative or false positive result of the test. And then after that, you give this the patient the specimen bottle. Basically, this is the specimen bottle that we're using in SQUH. Okay, we hand this to them. We explain to them what they're supposed to do, the perineal care, the washing of the perineal area, and then we give this to them. And our instruction is to collect the urine, specifically the midstream. Although it is very helpful in clean catch urine testing, but basically on all types of urine testing, we teach our students to collect the midstream urine. And students know that already because in theory we discuss it. Okay? But they should learn how to discuss it to the patient. When to collect, okay? At which part during urination. And importantly, part of their instruction is not to contaminate the inside part of this specimen bottle. Okay? Now, normally we use this one because nursing is an art. We do not just hand this to the patient. Okay? We instruct our students to use kidney basin and at least cover it with tissue because it doesn't look good if the urine is exposed and some patients may say it's not good like that. And then the students, when they return back to the washroom, from the washroom or bathroom, they will hand you this kidney basin containing the urine. Okay. And basically, the first thing that you're going to do as a nurse is to make sure that, okay, part of the instruction is the right amount of urine. Some patients might give you a little amount of urine which is not sufficient for you to dip the strips. Remember, the strips has 10 boxes. If they will just collect a few amount of urine, it will not be sufficient. So part of the instruction is to make sure that the amount of urine is sufficient. Okay? Now, once you receive the urine sample, basically you need to wear gloves. You need to teach your students to wear gloves because this is considered as infected. And the next thing that should be done is proper labeling of this one. Or you can do this before giving the urine specimen to the patient. Usually it's a sticker that we use in the hospital. Or in some hospital, you need to write the name, the ward, etc., the time, and the date. Okay. And part of preparation of this procedure is for you to have some supplies with you. And this is the one that we are using, urinalysis reagent strips. Okay, students will do this in the actual day and you will give them each strips. But it is very important that they learn how to use it and they learn how to use it. And I want you to teach them and I want you to show them first the strips. You can hand them each strips and tell them that it has 10 boxes which represents reagents for different examinations. And students might ask you what are the different components of the urine that can be examined. It is in the box. Like for example, leukocytes, nitrogen, protein, pH, pH, blood, specific gravity, ketones, bilirubin, and glucose. Okay? And each boxes represents those things. Okay. Now, the first thing that they're going to do is to tell them that when they dip this urine test, there are specific time duration. And normally it is within 1 minute. But to be specific, if they are really wanted to know the specific timing, it is also here. Later on, I will hand this one. Like leukocytes, it's 120 seconds. Nitrogen, 60 seconds, and etc. So basically the timing is there, you just need to follow. Okay. Now, aside from this, we should have at least a pair of paper towel. And since this is considered as an infected, make sure that they are protecting the tables wherever they do it. Okay? Now, in your lab demonstration, we will be adding some sugar or albumin or maybe some blood on this. So they will appreciate the changes or abnormalities in the urine component. But this one, I don't know what are the components of this. I just asked one student to give me urine sample. Okay, see? This is just an easy procedure. You ask them to dip the strip. Okay, make sure that all boxes are submerged. And then there might be some drips. Okay, and you need to wait for specific duration, 60 seconds. Normally, most of the components of the urine, you need to wait for at least 60 seconds. Then wait for 60 seconds. And you will observe some changes on the strips. Okay. For example, 1 minute is kala, 60 seconds is over. At this point, they have to read the changes in the color of the boxes and they need to report it and document it here. We will be providing the documentation sheet where all elements or components of the urine is there and they just need to indicate what are the findings. Now this one is very important. Each and every boxes represents different findings, and just below the box you will see the result. Basically the first column is the normal values. This is normal. Like for example, leukocyte, it should be negative. Protein, it should be negative. pH, it should be 5. These are normal. Okay. And as they move to this side, they will encounter abnormal boxes, which means there's an abnormalities in the urine. Now, 60 seconds is over. At this point, they have to interpret the result. There's a hand on the bottom, see? There's a small hand there. That means the hand of the nurse should be placed below. See the hand? Students might be doing like that. So the hand is there. It is properly guided. So they should start from the normal column. They should not start from here. They will be confused. Start from here and do reading one by one. They can start from the very bottom, the glucose. Try to check if there are changes. If there are changes, they have to move. They have to rotate the box and move the strips. Okay, and match the color of the box with the color in the box. If still it is not matching, they need to move until they find the correct match of the color. And then, how do you document the findings? The findings is indicated just lower the box. Okay, could be 2 plus, or it could be 500 milligram per deciliter. Everything is there. There are 3 findings here. They just need to copy it and write it here. Okay, and then they proceed with the second reagent or second box, bilirubin. See, bilirubin is negative. There are no changes in the color. And then they proceed with the third box, ketones. Ketones, the same color, it's negative, until they reach this area. Okay, here's the thing. After they document the records, the student might ask you, what are the relevance of each result? And at least tell them the basic. Like for example, what is the application if the pH is greater than 8 or lower than 6? And we know that pH should be slightly acidic. Okay? And they should learn that it is important, it is acidic, and it should not be alkalinic because of this. Okay? And aside from that, specific gravity, they might ask you also what is the important and what is the normal. It should be 1.010 to 1.025. What will happen if it is greater than that? What will happen if it is lesser? Excess fluid and deficit. There's dehydration, or maybe the kidney is not working well. It's not absorbing. It is in your manual. Just try to read those things. Okay? Also with the blood, they might ask you, is it normal to find blood or hematuria in the urine? And we know already that it should be none. And they might ask you why. Make sure to be ready why there is a blood in the urine. Okay? And also with the protein, they will ask you, is it normal to have a protein? It should be none. Okay? Because proteinuria is not normal. Although in some cases, there are few traces. Okay? What else? Glucose, definitely. For normal individual, there should be no glucose in the urine. But in diabetic patient, they might expect some glucose in the urine and you might observe some changes on it. Okay? Ketones also. Definitely there should be no ketones, but if the patient is starving or if the patient is diabetic, you might expect some ketones on it. You need to discuss to them why the findings is abnormal and what is the reason behind it. Okay? There are some other components here which would be very difficult for the students to absorb, like bilirubin, urobilinogen, because of the bile. Those things, try to explain to them in a simple manner, but try to emphasize that those things will be explained further in adult one. Okay. Also with the leukocytes, negative should be the result. If there is leukocytes, there is urinary tract infection. And then they have to document. As easy as that. Okay? In the actual day, hand your student one sheet per student and an individual record. And you can prepare at least 2 preparation. Maybe you can put more sugar on one urine, and maybe you can put egg yolk on other one just to add some protein so that they can appreciate the changes. And let them document, and you need to check. Okay, you need to collect this one. That's what we do. And of course, proper disposal of the strips is very important because this is infected, and proper disposal of the urine itself. We have a utility room. In the hospitals, we have a utility room in each ward. I do not know if you are familiar with the wards. They cannot just dispose this one in the ordinary sink. There is a utility room. It is where they're going to dispose this one. Not even in the bathroom, because some urine are infected. Anyway, here in our lab, we also have a utility room. We're going to show it to you later. I think second to the last.
We will show you last.
Yeah, we will show you how to dispose this one properly. And on the actual day of practice of your student, please do not leave this one in your table. We will be receiving complaints of urine on the table, and make sure teach your student not to dispose it there. Okay? That's it for urine testing. Anyway, you will see this one later. You can. And for disposal, you can ask your student just like what we do in temperature taking, like this. And then, because nursing is an art.
For documentation, they have to do it that time because one by one they're wearing gloves and usually ask the student to.
Yeah, in the actual day, they do it by pairs.
Okay.
So that one student is recording because they will be contaminating the papers, the
Yes.
pen, etc.
Yes.
And we don't want them to do that.
Because it's a dirty procedure, we don't ask it like that. Don't tell them that.
During the time of Dr. Soja, I do not know if Miss Deepa was there. We had this as part of the exam. And it's not.
It's nice.